Okay. Okay, and so LGBTQ individuals are almost 3 times more likely to experience a mental health condition like major depression or generalized anxiety disorder. And so I want to pause for a minute on that idea and say that right now, the rates of depression in the general population are 1 in 4 for adults and 1 in 5 for children. A 3-fold increase is dramatic. Right? These conditions are common, they're not rare. And so 3 times as common is a whole lot of kids who are struggling. Okay, the most common mental health disorders in this group are depression, post-traumatic stress disorder, largely due to abuse, maltreatment of many, many types, suicide, and that's listed separately than depression, and I'm really glad about that because we've come to equate, particularly in the public discourse, depression and suicide. Oh, this person killed themselves, they must be depressed. Suicide is not directly correlated only to depression. Suicide is correlated to hopelessness and may be the result of addiction, post-traumatic stress disorder, bipolar spectrum disorders, schizophrenia, eating disorders, the wide range. And so it's not always as simple as depression. And then substance abuse is higher in this group as well. And again, these are dramatically higher than the general population when certain conditions are met that we'll discuss. Okay, LGBTQ youth fear coming out and being discriminated against for their sexual orientation and gender identities. And this may contribute to the higher rates of their mental health conditions, right? So not only do kids experience direct discrimination, but they're afraid to be authentic, which has been associated with better coping skills and improved overall mental health, to be open, to talk about your feelings, to share of yourself honestly with others. If you're not able to do those things, then it contributes to feelings of isolation, aloneness, and to the general level of stress. Okay, and so I think this is a really important key point too. There are 3 or 4 things that I want you to take from this talk today. And this is the first, okay? So stigma and prejudice works like this, that the stigma of mental health conditions is one prejudice. We know that people with mental health conditions often feel that they can't be open about that with their peers. People say insensitive things. We've all heard, those of you who work with anybody with a mental health condition, if you provide counseling, if you talk to kids, they'll be told, well, I don't think there's really anything wrong with you. You should just change your diet. You need to stop eating junk food. That's what's wrong with you. And this, in many cases, are severely depressed kids. Or, you just need to pull yourself up by your bootstraps. You could do better than this. You just need to do more. And then the prejudice due to their LGBTQ status, right? So for some, this is the perfect storm. And so what happens is that you combine the 2 issues and you have, especially kids, who report having to hide their sexual orientation from their therapist, from the kids who attend their group therapy sessions, from their doctor, right? They feel like they can't talk about those things because there'll be discrimination there. And then they have to hide their mental health conditions from their supportive LGBTQ community. And so no matter where you go, there's no safe place for all of it when you have depression or anxiety or any mental health condition and you belong to this group. You're sort of anxious, afraid to disclose, encounter discrimination, so it really creates a larger set of problems. Okay. So, LGBTQ youth may seek mental health treatment, but face a lack of awareness and understanding of the issues within their healthcare community, okay? And so people may go in and say, I'm struggling. And I remember one time I covered for a colleague and I saw one of her patients. And I didn't know the young man, but he came in and she had been on vacation for an extended period and asked that I could see this unstable young man. And when he arrived, he was very angry. He actually ended up walking out of the session with very little support that I could provide him because his immediate assumption is that I couldn't accept his sexuality. I'm not entirely sure what the details were of his sexuality, but he had had so many bad experiences that trying to connect with a new person, especially on a short-term basis, had him angry, attacking, and walking out of the session. And so, you know, people have had some pretty traumatic experiences in healthcare. So the double stigma can be particularly harmful, especially when somebody's trying to seek treatment. If your LGBTQ friends say, you know, we're here for you, we love you, but oh, you don't need to take those medicines, you're not bipolar, right? And we hear this in other populations as well. You know, don't do that. So you're isolated to the small group of supportive people anyway, and if they don't understand your mental health, you're in real trouble there. And then the LGBTQ community may say, don't go and talk to those people. They're not going to understand. They're not part of our community. I don't trust any of this. This is just what your mom wants you to do. She thinks there's something wrong with you. You know, your family's trying to change you, and so forth. And then the healthcare and counseling community doesn't necessarily support the sexuality, and in some cases, as I said, it's an excessive focus, but in some cases it's important and it's ignored. All right, the rates of mental health conditions are particularly high in bisexual and questioning individuals. Raise your hand if that's surprising. Okay. And so my observation from talking to people who identify as bisexual or questioning is that in many cases it's hard to be nowhere in a particular group. At least if you're gay, you can identify as gay and it feels more certain. That's one factor. I think the other factor is people who are questioning are as yet unsure. And when you're unsure and you feel that you can't be authentic with it, you can't find your way through it, because if you identify with one side of what your experience is and you decide that you are gay or you are bisexual, then you end up facing a backlash from your school, your parents, your grandparents, whatever that is, okay? Mental health conditions are high in people who fear to reveal their sexual orientation or their gender identity. And so this is a very, very common issue in the urgent care clinic. It's very common for me to see an adolescent between the ages of 12 and 17 who comes in and says, after their mom and dad leave the room, well, actually I'm gay, or actually I'm bisexual. I've never told my parents because they will never accept me. They will kick me out. I will be homeless. They will disown me. They will not pay for college. In some of these cases, these kids are right. And in some of these cases, these kids end up being incorrect. But either way, if your experience is, I can't be honest with the people I love and the people who love me, because something bad will happen if I'm truthful, that's a real bind to place, particularly a child and a tumultuous adolescent. If you're already in a psychiatric clinic seeking help and having trouble, I think it's important to note that this is the kid who can't handle being unable to disclose. All right, and then people who choose not to reveal, even folks who are not in the category of they're afraid to reveal. People who say, I'm not ready, I don't want to talk about it, I feel like this is private, this is not something I want to share, still experience a sense of isolation as a result. All right, LGBTQ people report less mental well-being and satisfaction on rating scales. So if you just do demographic statistics and you say, you know, what's your race, what's your gender expression, and your sexual preference, and then you know, what's your rate of well-being and satisfaction, it's actually remarkably low just in general studies, even for people who don't meet criteria for any illness. And so, you know, I think the other thing that's important about that is that mental health challenges, discrimination, and violence are all reasons that this comes up. Discrimination in particular is a broad topic for this group. Okay, LGBTQ youth have a higher risk for suicide. In fact, it's dramatic. It's alarming. LGBTQ people aged 10 to 24. Suicide is one of the leading causes of death, and LGBTQ youth are 4 times more likely, and questioning youth are 3 times more likely to attempt suicide. We already have a crisis of suicide in our youth. The rates of suicidal behavior and suicidal thoughts are increasing. And again, when you think about how alarming it is, if I said to you, teen suicide, all of us are alarmed about that. So to think about a subgroup of our kids who are actually 3 to 4 times more likely to attempt suicide than other kids is frightening. Okay? Between 38 and 65%, so that's almost 2/3 of transgender individuals experience suicidal ideation. So put a different way, a transgender kid is more likely to have suicidal ideation than not. 2/3. So if you have, 3 kids who identify as transgender, it's very likely that 2 of those kids will be suicidal. And I think this is really important for all of us who work with kids, to be on high alert for addressing this issue. Individuals who faced rejection after coming out to their families were more than 8 times more likely to have attempted suicide than someone who's accepted by their family. I'm not surprised that these rates are higher, but 8 times. These are phenomenal numbers. And again, if you think about the rates of suicide attempts in our youth are already concerningly high, and you 8-fold increase that number. LGBT community reports higher rates of drug and alcohol and tobacco use, and again, very high. So factors that contribute to substance use include prejudice, discrimination, a lack of cultural competency in the healthcare system, and a lack of peer support. So just like other mental health conditions, addictions and substance abuse are higher for some of the same reasons. 20 to 30% of LGBTQ people abuse substances, compared with about 9% of the general population. So that's 1 in 3. If you're seeing somebody who is transgender and they haven't attempted suicide, the chances are really high that they're abusing substances. 25% of LGBT people abuse alcohol, compared with only 5 to 10% of the general population. And so, again, I think it's almost a given that if you're seeing somebody who belongs to this group, that you need to be concerned about their mental health and about their addiction issues. Okay, LGBTQ young people face fear, hatred, and prejudice in school, with friends, in the community, at home, and that leads to higher rates of suicide and self-harm. LGBTQ teens are 6 times more likely to experience symptoms of depression than the general population, 6 times more likely. I don't know if any of you have seen some of the recent studies about the rising rates of depression and suicidal thinking in kids. Has anybody looked at that data? So particularly in young adolescent girls, there's been a huge rise in the rates of mental health conditions and suicidal ideation. And so 6 times is really dramatic, and that starts to get into a majority of these kids. LGBT youth struggle in coming out to family members, friends, classmates, and teachers, especially if they're not accepting. And so the common way that I see this clinically is that there's actually usually been very little direct discussion with the teen or child. The family maybe has expressed some general views that contribute to the child's understanding of what their belief will be, but sometimes there's never been, hey mom, what would you do if I was gay, right? There's only the belief that mom and dad can't accept this as a possibility. And so I think that's important because the fear of discrimination or lack of acceptance is not necessarily based in the direct reality. It's based in the perception. All right, so I want to spend quite a bit of time talking about the GLSEN, the Gay, Lesbian, and Straight Education Network. This group has done quite a bit of research on the conditions that LGBTQ kids face at school. And I think can be very instructive for us on what can be done to help this group of kids. All right, so they report on school experiences in U.S. schools. So before I go into that, I'm going to take a moment and ask, on anything we've talked about thus far, does anybody have any questions?
I don't know how to word this question. I'm thinking about it in my head. But are there studies that show, like if a teenager comes out and says they're transgender or whatever, gay, and they attempt suicide, if they get help, if they seek help, do those numbers go down dramatically, like the suicide attempts, or will they continue to struggle with it even with help? Like if they're accepted and they come out, like I don't know if it's a struggle before they talk to family and have support, or is it just, does it just continue?
Yeah, so this is a really good question. The question is, if someone is a member of the population, the LGBTQ population, and they come out and they seek help after maybe a suicide attempt, do they get better? And we'll address some of that here, but the answer is being in mental health care treatment with a competent provider who understands that aspect of the person and can deal compassionately with it helps. Being out to family and being supported helps. Being out at school and having a school environment that's supportive helps. And so if all of those conditions are met, and they rarely are, then the risk factors of this child or adolescent can begin to approximate the general population. And so that tells us something about why these rates are so high. If the person is isolated at home, can't disclose to family, depressed and not getting care, doesn't feel understood because they're gay or transgender or whatever their issue is, and doesn't exist in a school environment that is a supportive place where they hear, slurs and they hear discriminatory remarks all the time. All of those things definitely appear to make it worse. So rectifying each element of that does appear to begin to restore that child to closer to the general population. And that's a really good question. Any other questions? Yep.
The data that you just gave to us, does it cover the general population, or is it inclusive of students with intellectual disability or students with...
Yeah, so these are general population studies. And I'm not sure for kids with intellectual disabilities if they're a direct carve out. I'm not sure. But so a lot of these studies, and as we go forward, we talk about some of the data collected by the GLSEN. That group collects data in schools. So these are regular students or all students who can complete a survey. Now, kids with intellectual disability, there'd be a question about their level of disability and how well they can understand, participate in the questions. But these are demographic studies. Sometimes these studies are administered at the time when testing is done. So, they try to have everybody on the campus, even if they take a modified test or whatever, and they give them the survey. The question I don't know the answer to is if all the kids can complete the survey, if they have help, if anybody's excluded because of that issue of not being able to complete the survey or being carved out during testing.